Ready to go? Good morning, everyone. I figured I'd start with a dumb joke because those are my favorite. You know how to tell a male ant from a female ant? If you throw the ant in the water and it sinks, girl ant. If you throw it in and it floats, that's all I got. So my name is Nicole Vega. I am the Vice President of Clinical Services. Hopefully most of you know me because I've been with you for a little over 10 years now. I am a registered nurse with over 20 years of experience. I have a master's degree in nursing with an emphasis in leadership and management. I have a board certification in infection prevention and control and a certification in dementia education. And then I'm a licensed nursing home administrator as well. I have entirely too many slides to get through, so we'll see how we do for time. So I often talk about the big picture that we have at John Knox and the services that we have so that you fully understand everything that's available to you as we move through the program. I'm going to kind of talk about each individual clinical service that we have. When we look at the big picture, we obviously have you in the center because all of our services center around you. So we have Martha and the Nurse Practitioner Clinic, our medical response teams of Stephanie and our EMTs and paramedics, our home health division, both skilled and private duty services, outpatient therapy, Oakview Suites Assisted Living, our new Oak Haven Premier Memory Care Assisted Living, and of course Majestic Oaks. So when we look at health and wellness and illness, we look at it as kind of a continuum. And when we're healthy and well, everything is good. And then when we shift to illness is when things are not so good, right? So we need to be planning health care decisions when we're well, looking at advanced directives, researching insurance and supplemental policies, communicating wishes to the medical staff here at John Knox, gaining knowledge about active disease processes you might have going on, medications that you're taking, and anticipating what might happen should that pendulum swing in the other direction. When you're ill or hospitalized, that is not the time to be making life decisions. There's a lot of anxiety about what's happening and whether a full recovery is possible, stress about finances and disrupted plans, frustration about slow progress of recovery, and then fear about what the future looks like. So while you're healthy, we have kind of a planning checklist for you. Review and update your advanced directives. It's hard for us to carry out your wishes if we don't know what they are. Identify who your decision maker will be if you're unable to make decisions for yourself. Make sure your power of attorney includes a health care provision. A lot of the powers of attorneys that we see are just financial, and they don't include a health care provision. If you don't have that in your power of attorney, make sure you establish a health care surrogate. You can establish a health care surrogate while you're well. Once you're not well, you can no longer name a health care surrogate. Right? Decide whether you want to be a full code or if you would prefer a do not resuscitate order. Keep John Knox updated with your contacts of who is authorized to enter your unit when you're not here. Make plans for your pets if you become ill or can no longer care for them, and make sure John Knox has that information on file. And keep an updated medication list. Did you know that 1 in 3 U.S. adults, only 1 in 3 have an advanced directive on file, leaving families to guess about what they would have wanted? So we'd like that to be 3 out of 3 at John Knox. When we look at the aging process and why mobility is so important and why we have such an expansive exercise and fitness and wellness program is because the goal is to preserve independence. We want you to stay as independent as possible for as long as possible. We want to make sure that you're able to do those daily tasks, cooking, cleaning, bathing, and a lack of mobility results in a loss of independence. Preventing falls. We spend a lot of time talking about falls at John Knox. And reduced mobility is a key factor that increases your risk for falls, as well as affecting balance. So core muscle strength improves balance, which in turn helps prevent those falls. An improved recovery time. The more mobile you are prior to an event, the less time it takes you to recover if there is an illness or fall. Decreased muscle mass and strength with lack of mobility. Adults can lose 3 to 8% of their muscle mass per decade after 30. The decline contributes to impaired mobility and makes simple movements even more difficult. And then bone, joint, and cardiovascular health. Arthritis is more prevalent as we age. Weight-bearing activities help to maintain bone density and heart health. And staying mobile doesn't mean intense exercise. Staying mobile is simply a daily stretching routine, getting up and moving a little bit in the morning, range of motion, focusing on moving all of your joints. So simple range of motion, just taking the joints from a flex to an extension. Make sure you're moving your large joints, your shoulders, your neck, hips, knees, ankles. Simple muscle contractions, again, just that flexing and extending. Something as simple as sitting there pumping your ankles while I'm talking. Raising your knees towards your chest. One of the key indicators of safe ambulation is while you're seated in a chair, if you can raise your legs and hold them up for 20 seconds. You're going to have to try that here, but you can try it later at home. And then daily walking, right? I see a lot of residents walking about, even something as simple as parking a little bit further away at dining. Sometimes you do that without choice because it's crowded. So we want you to know what the full view is of what's here to support you. We have a comprehensive plan to ensure healthcare services for all of our residents. They're designed to promote aging in place, to promote independence for as long as possible. But independence doesn't necessarily mean without services. And like I said in the beginning when I had my slide with the resident in the center, the resident is centered to all of the clinical services we know. And did you know that 88% of adults say that staying in their home as long as possible matters to them? I find that a shocking statistic. I think it would be 100%. Show of hands, everybody that wants to go live at Majestic Oaks? Case in point. So let's look a little bit at what we mean when we're talking about independence and a little bit about the Life Care Committee. So independence means that you are alert and oriented to person, place, time, and situation. You know what's happening and when it's happening around you. You're able to provide us appropriate responses when we ask questions. You're able to recognize emergencies such as a fire alarm, and in the event of that emergency, you're able to safely exit your residence. You're able to utilize those emergency strobe lights that we put out during hurricanes for power outages. And you're able to perform your activities of daily living. So when we talk about activities of daily living, those are bathing, dressing, grooming, toileting, and eating. And all we ask is that if you're struggling with any of those areas, allow us through home health or through therapy to support your independence. So what's the Life Care Committee? The Life Care Committee is an interdisciplinary team across campus. It is all of my clinical leads, so the director of nursing from Majestic Oaks, the leadership from both assisted livings, leadership from home health. It includes Michael Buxton and Stan DaCosta and myself, and it's chaired by Stephanie, the resident nurse. And again, with the goal of that committee being to keep you as independent as possible for as long as possible. We meet and we review incidents and accidents that have occurred in the previous week, and we look for trends. For example, if you've set your smoke detector off 4 times in the last 30 days because you forget something has been on your stove, that's a red flag for me. If you only do it once, it's okay. But we do track it. If you have recurrent falls, that's potentially a flag for us. If you get lost out and about, potentially a flag for us. So we do review those situations and see if we can put in things that might help. Do you know that 40% of patients don't take their medication as prescribed? They either take a half a dose, don't take it as frequently as they should. But inappropriate medication use is the second leading cause of hospitalizations among seniors. And we find things. I've found cat treats in pill planners. Hope you're not taking cat treats instead of pills. So we want to make sure that you're safe. So if the Life Care Committee does talk about something that's occurred, you may have a variety of recommendations. So there may be a visit from Sarah, the wellness liaison. She may come out and see you. You may have a visit from the resident nurse. So Stephanie might come by and check on you. We might make a recommendation that it's time to follow up with your primary care provider. Maybe we make a recommendation that it's time to go get your vision checked. If you haven't changed your glasses prescription since 1974, it might be time, right? We might make a recommendation for outpatient therapy services or a recommendation for home health services. But again, all of those are designed to prolong your time in independence. So these are the people behind all of the various sections. So first you have our resident nurse and medical response. This is my RN and paramedics and EMTs. Most of you probably know Stephanie. You've probably met her when you first moved in. I have EMTs and paramedics that work in the evening hours. They provide a dedicated medical response for approximately 16 hours a day. They respond to that courtesy call system when you pull your cord or press your pendant, and they're going to triage medical issues. Now, they are not designed to replace medical care services. They are just designed to kind of bridge that gap and make sure you get the necessary services you need at that time. We also conduct wellness visits. So if you've been in the hospital, Stephanie or one of the members of the wellness team will come out and see you either that evening or the next day and make sure you have everything you need. You got your prescriptions. If you need meal delivery briefly, we'll set those things up. Typically, the first experience a resident has with any member of our medical team is with Stephanie when you first move in and she comes out and does that meet and greet. Most people don't remember that because it's amongst you moving in and your boxes are still not unpacked and you have the large packet of information to read through, but she came and saw all of you. She's going to conduct an initial assessment, and we're going to look to see on admission if you have any deficits that we need to be concerned about. Is a spouse a caregiver for someone? Are you already utilizing assistive devices for ambulation? Do you have any difficulty answering those questions when she's out conducting her interview? And on average, our medical response team responds to 80 calls per month. And there's Martha. Martha's our nurse practitioner. She does specialize in geriatric medicine. She's been with John Knox for about 12 years now. She focuses on primary care, and she is licensed in Florida for autonomous practice, which means she does not need to work under a supervising physician when she's providing primary care services. She focuses on preventative care and wellness exams. She handles a lot of chronic disease management, so hypertension, diabetes, COPD, heart failure. She is available for office visits Monday through Friday. We also have lab services in the clinic on Mondays and Fridays. She's available for a second opinion if you've seen your provider off campus and you want a second opinion. And what's great about Martha, she is able to follow residents through the continuum. So sometimes when we see significant changes happening with a resident or cognitive issues happening, we're going to recommend to transition physician services to Martha. One, it's a lot of work to put somebody in a vehicle and transport them to a doctor's appointment when they're already having some cognitive issues. We usually then need to staff someone to go with them because they may not remember the information shared with them by the provider. So having the provider as Martha, where we can communicate amongst healthcare providers on campus is really helpful. Then we have our wellness services liaison, Sarah Tracy. She's in the back. So Sarah addresses common psychosocial aspects related to life changes and promotes wellness. She might link you with various services across campus, certainly assist in the coordination of any resources that we have available to you. She provides educational programming and tools and supports residents through end-of-life changes. She has spearheaded several support groups, including the Parkinson's support group, grief support, caregiver support, a visual impairment group, memory impairment support, diabetic support, and chronic pain and fatigue. Do you know that 1 in 4 older adults experience social isolation, and that social isolation is linked to a 50% higher risk in dementia? So please come out and join one of our groups. Socialize. Home health services. This gets a little confusing. So, home health is divided into 2 different categories. We have skilled home health services, and then we have private. So we're going to talk about skilled first. So skilled home health services typically go into effect after you've had some type of hospitalization or inpatient stay somewhere. It doesn't have to be. It can be directly ordered through your physician. But it includes a nurse, usually a registered nurse, a physical therapist, an occupational therapist, speech therapy. Your physician will dictate what services they want us to perform and at what frequency they want us to perform them. And then that physician will continue to oversee care while you're on those home health services. And studies show that older adults with caregiver support experience an increase in high life satisfaction from 39% to 54%, while unsupported seniors stay flat at 40%. Underskilled services, because these are driven under Medicare guidelines, there are very specific criteria you have to meet. So you have to be confined to home, and I'll get into that a little bit. You have to need those skilled nursing services. You have to be under the care of a physician. You have to receive a plan of care established and reviewed by your physician. So every 30 days, we revise and update the plan of care, and it has to be sent back off for signature. And you have to have had a face-to-face encounter with your provider prior to starting services. This typically, like I said, follows a hospital stay or some other inpatient stay. So if you were at Majestic Oaks, for example, and you discharged home, they might discharge you home with skilled home health services. So the confined to home criteria throws people off at John Knox a little bit. It doesn't mean you can never leave your home. It means that you have to meet one criteria in the first box and both criteria in the second box. So that because of illness or injury, you need the cane of an assistive device, so canes, crutches, walkers, wheelchairs, or you require assistance with transportation or the assistance of another person to leave the residence, and having a condition that leaving the home is medically contraindicated. So we think back to COVID, leaving the home was medically contraindicated because we didn't want the risk of spreading the illness. And then on the second box there, both of those have to exist. There must be a normal inability to leave the home, and leaving the home must require a considerable and taxing effort. So we'll come out and evaluate you. Now this could be a temporary situation for you. Maybe you're only homebound because of your current illness. That's okay. We're going to get you better, and then we'll discharge you from home health services. What counts as homebound? If your absences from home are infrequent, for periods of relatively short duration, for the need to receive healthcare services, so you can go to a doctor's appointment or follow-up visits, for religious services, so you can still go to church, you can attend adult daycare programs, or other unique and infrequent events such as attending a funeral, a graduation, going to get your hair cut, what have you. So could you still go to Crane's for dinner? And you could still meet the homebound criteria. That's an infrequent visit, it's for relatively short duration, and you would be back at home. So that's skilled home health services. Private services are not dictated by Medicare, so there's much less requirements on private services. However, they're also not covered under your Medicare benefit. They are paid for privately. Private services can include both skilled and non-skilled services, however, so you can have a skilled nurse, you can have a licensed nurse come out and provide services under private duty. It's just not covered under that Medicare benefit. So we do a lot of medication management for residents. We do daily med administration, or we set up weekly pill planners. We might provide wound care, catheter care, disease management or education. And if we're going to put a skilled nurse service in, we will get an order from the physician. It's not the same requirements for Medicare, but we want the physician to be aware that we're out providing those services. If we're doing medication support, so our weekly pill planners, for example, we're going to set up your weekly pill planner or come out and do daily med administration. We typically only come out in the morning. We're going to monitor your vital signs once a week and make sure you're stable. We're going to monitor your weight weekly. We're going to manage all of your prescriptions, so we'll worry about all of your refills, if you need prior authorizations, communicating with physicians, if you're having any side effects or challenges with medication, and then we will do medication destruction for anything that's expired or no longer in use while you're on those services. Private services also includes assistance with labs and physician communication. So we can help get you to any physician appointment. We can help with scheduling or rescheduling those appointments, setting up the transportation, completing any paperwork. Let's say you're starting a new physician and you've got the 10-page welcome aboard packet to fill out for them. We can help with that. Confirming appointments and providing reminders to you. We will manage all your lab services, so we'll make sure that your labs are ordered timely, that we get you to lab services, that we make sure you get the results, and that those results get sent back to your provider. We'll communicate information to your medical power of attorney if that's necessary. And then if you have long-term care insurance that you want to utilize to help cover the cost of private duty services, we will assist in filing those monthly claims. We also have home health aides that can provide in-home services. So things like that ADL support we talked about in the very beginning. Bathing, dressing, grooming. So maybe it's just something as simple as you're a little nervous in the shower because you had a fall a couple weeks ago in the shower. We can come out and help with showers a couple times a week. If you're experiencing any issues with incontinence, meal assistance, safety and fall prevention, general companionship, pet care and pet walking, shopping trips, and assistance with transportation. We also offer extended care hours through home health, so we can do those in 4-hour, 8-hour, 12-hour, or 24-hour a day services. And so we want to make sure that the residents are supported as best they can be. Where we'd love to do 24-hour for everybody, sometimes that's not appropriate. And if we think that care in the home is not an appropriate option, then we'll discuss that with you individually. And research indicates that home visits and community-based programs effectively reduce or delay the need for long-term nursing home and institutional care, which again is the goal, because none of you raised your hand when I asked who wanted to go to Majestic Oaks. We also offer Time Out Tuesday, which is a break that we give for caregivers. Currently, it's only offered on Tuesdays, but it coincides with the caregiver support group meeting. And so we meet every Tuesday from 1 to 3, so it allows you as the caregiver of a spouse to drop your spouse off with us. We meet in the Creative Arts Room inside Oakview Suites. We get lunch from the grill, and they do games and activities and keep the residents engaged while you're able to get a little breather. You don't have to go to the caregiver support group during that time. Maybe that's the time you need to go to Publix or you want to make a Walmart trip. It's available to you, and we would encourage residents to participate in that. And you can contact Home Health if you want a loved one to participate in that. Outpatient therapy. So we also have outpatient therapy, as you know, here in the gym with Chris and Kyle. Outpatient therapy is a set of interventions designed to optimize physical functioning, to reduce disability, and to improve your interaction with your own environment. We might address underlying health conditions and their symptoms. We might modify a home environment. So maybe we need to go out and install a shower rail or a toilet frame, which makes it easier for you to move about. What we don't want you doing is using the towel holder as you're climbing out of the shower, because that's not designed to support your weight. We'll help you with any assisted devices. We want to make sure that walkers and canes are at the appropriate height, that they're safe to use. They weren't passed down, by 3 sets of neighbors, and so we'll make sure that those are safe for you. And then provide education and task adaptation so that activities can be performed safely and independently. So kind of some examples of things that we've done through exercise programs and therapy. So physical exercise training programs to improve strength, muscle, voluntary movement, and balance for patients with strokes or Parkinson's disease. Again, modifying your home environment to improve safety and independence. It may be something as simple as turning your bed the other direction so you're getting out closer to the bathroom. There's different things that we can look at. Mobility and strengthening to decrease pain and improve range of motion. People experience a lot of pain that they just attribute to getting older, but there's a lot that can be done through both physical and occupational therapy modalities to relieve that pain. We will educate on a person with heart disease and how to exercise safely, positioning and splinting techniques to assist if you've had some type of injury, burn, some type of surgery, and then speech and language training to improve communication after a brain injury, so stroke, seizure activity, anything like that. Occupational therapy is designed to provide upper body support, cognitive support, and ADL assistance. And so we ensure that you remain independent with those activities of daily living. Again, that bathing, dressing, grooming. Occupational therapy is available to come out and do a home assessment where we can look at things that might be reducing fall risk, relocating furniture, that bathroom modification, like I said, grab bars, toilet frames. Maybe we need to modify how you're getting into the shower if there's a step up, something like that. And then pain management for upper body, neck, shoulders, elbow, wrist, and hands. And then again, they support that those ADL functioning, helping you with those activities to conserve energy and maximize safety. You know, we have the driving simulator in outpatient therapy, so sometimes we work on driving safety, reaction time, and range of motion, because even a simple task of turning and looking behind you can be taxing to some people who are having issues with neck pain. We provide assistance with meal preparation, laundry, and medication management, and they can also help with re-educating and getting you back to providing those services independent. And then doing things that you like to do, whether it's writing or gardening. We can find ways to support you through therapy services to get you back doing something that you might have stopped doing because it's become difficult. For speech, we address cognitive and communication concerns, so memory, attention, problem solving, organization, voice. So a lot of times with Parkinson's, your voice volume is softer. You might become hoarse. My voice has been trying to go on vacation for a couple days now. You may have a harsh voice or pitch changes in your language. You may have errors in understanding what you hear and using words to express those ideas. And so there's a lot that speech language pathology can do to improve that. We also improve issues with swallowing, choking or coughing while eating, or food just going down the wrong way. If your nose runs a lot while you eat, you should probably make an appointment to go see the speech therapist. That is a sign of aspirating food. Speech sounds, whether your speech is distorted or slurred in any way, and then social communication, learning to take turns, body language and communication norms, which sometimes patients have a difficult time recognizing after they've had some type of brain injury, stroke, things like that. We now offer aquatic therapy, and since it's 150 degrees outside, it's a great opportunity to do that. Water therapy is gentle on your joints. It allows for that buoyancy to reduce the impact of gravity, making it easier to move and less painful. Water therapy is a little less intimidating than getting on a weight machine if you've not done that before. For better balance, working in the water helps you to improve strength, helping you stay upright and improve stability, which is again a huge factor in reducing falls. Full body strength, the water provides resistance in every direction, helping you use every muscle at the same time. Helps with cardio and endurance. Helps get more control over muscle movement with less strain. And then it's good for things like arthritis, COPD, coronary artery disease, multiple sclerosis, osteoporosis, scoliosis, and strokes. So Kayla offers that program, and she's known as Killer Kayla, so be aware. She was my therapist too. All right, let's talk about fall prevention a little bit. So again, we spent a lot of time talking about falls. We spent all last year in the healthcare committee talking about fall prevention strategies. So a lot of what we want to focus on is strengthening your core. We offer a lot of exercise programs focused on core strength, like Tai Chi. We have home safety checklists where you can kind of go through your home. Things like rugs, provide trip hazards, create issues. even something as simple as a night light so that you can see moving your way to the bathroom at night. Awareness of medications that contribute to falls. We put out some information last year about medications that contribute to falls. There's a lot of them. Postural hypertension prevention. So everybody should dangle before you get up. So you should get up, you should sit at the side of the bed for a couple minutes and let your blood pressure stabilize a bit. So don't just sit up and jump right out of bed. And when you get out of bed, you should do some static standing and just stand there and let yourself kind of readjust a little bit before you start taking those first steps. If you have fallen in the past year, if you are unsteady while you're walking or you worry about falling, if you use furniture to move about in your home, then, or if you have trouble rising from a chair and walking 10 feet in under 15 seconds, that automatically defines you as a fall risk. We would like to prevent as many falls as possible because falls equal injuries, right? 1 in 10 falls causes a serious injury that limits your activity. Falls send nearly 3 million adults to the ER and about 1 million hospitalizations every year. 83% of hip fracture deaths and nearly 319,000 hip fracture hospitalizations a year are caused by falls, and they are the leading cause of traumatic brain injury in older adults. And I don't know if you remember my slide earlier, but I said we respond to about 80 issues a month in medical response, and that's just too many. It's too many to risk what comes with that. As a side note on that, we're all very helpful at John Knox. Your neighbors are all very helpful. It's not a good idea to have your neighbor get you up after a fall, okay? Sometimes there's an injury that's not detected. Sometimes when your neighbor tries to help you up, we end up with 2 people on the ground instead of 1. And I know people say, oh, we don't want to call you. You're going to send me to Majestic Oaks. I promise you I'm not going to send you to Majestic Oaks. I promise. That is never my first option. Might I tell you to go to outpatient therapy? Absolutely. Might I tell you to go follow up with your physician to check your medication? Yes. But Majestic Oaks is never our first recommendation. So please don't worry about that. And please call if you're having trouble. Let us intervene. If we intervene early, we can possibly get to the root cause of what's happening and prevent it from occurring. So let's talk about our levels of care. Time frame, I'm doing okay. I know this is kind of small, and I kind of squished it together because Mike Buxton covered a lot of this in his chat, so it's just kind of a recap. So if we look at our 2 assisted livings, Oakview Suites is the first column, memory care is the second column, and Majestic Oaks being the third column. So licensure type, Oakview has a standard assisted living license, as does Oak Haven. We can do extended congregate care services in Oakview Suites, allowing residents in Oakview to stay there longer should they have some changes. And then Majestic Oaks is licensed as a skilled nursing facility. Our assisted livings are designed for people needing help with daily activities, medication, transfers, and mobility. And then Oak Haven more for residents who are having issues with Alzheimer's or dementia and may require that secure setting. The nursing home, I'll talk about in a little bit more detail. I have a different slide about Majestic Oaks. We have 49 studio apartments, 49 studio or 1-bedroom apartments in assisted living, and 64 units in Oak Haven. And all of our services, you can have home health services in any location. You can have hospice support in any location. So we can structure programs that work best for you and what services you need while you're in those different facilities. Majestic Oaks facility is something that level, so we can manage surgical drains, infections, isolation procedures. Again, those are outside of the scope of regulation in assisted living. So you cannot be in assisted living with anything greater than a stage 2 pressure ulcer, and you cannot need isolation services. So there may be times that we transition between one of our assisted livings and Majestic Oaks temporarily, and then get you back to the assisted living so that we're not outside of our regulatory requirements. Majestic Oaks also offers a lot of behavioral health services, so both psychology and psychology services. Our full therapy suite at Majestic Oaks, so physical, occupational, speech therapy, We can assist with dialysis. And then Majestic Oaks, of course, is supported by the pharmacy, but we also have a dispensing system at Majestic Oaks that allows us to dispense 300 of the most common medications or IVs that are ordered that we can get instantaneously and not have to wait for those to be delivered from the pharmacy. So those are more readily available in Majestic Oaks over assisted living. Let's talk about some practical matters. So things that everybody wanted me to cover. Let's talk about ambulance transports. We are seeing an increase in automatic denials through Medicare should you require an ambulance transport from John Knox to the hospital. You will get a bill of about $750, and they will tell you that your service did not meet Medicare requirements. They will tell you that you can appeal that. Please do not. Call me. I will help you file the appeal. I will use Medicare's language against them in order to get that approved. I have been relatively successful in getting those covered for people. Not all the time, but we've even gone all the way to a judge advocate and gotten it approved for somebody. So I took it to 3 appeals for somebody, and we won. So please, if you get those, don't get frustrated by those bills. Like I said, it's almost automatic right now that they are denying ambulance transports. What I need from you, though, is I need the bill. I need the appeal letter that they tell you that you can to fill out, and then any hospital paperwork that you can get. So if you can get your ER information, I will use your medical information to support the need for services through Medicare. So please let me know if you get that, and I will assist you. I have a couple that are out right now. So, and we only have about 90 days in which to file those. So when you get them, please get them to me right away. You can either drop paperwork off with Tina or call me and make an appointment. I can come pick it up. But let me help you file that appeal. We've had some issues where if your first level appeal is not strong enough, it's harder for me to get a second level appeal. So it's easier if I can help you with the first one. Insurance coverage. So we accept a wide range of Medicare, Medicare Advantage policies, Medicaid, and commercial insurances across our service lines. However, coverage varies significantly by plan, by service, and they can change year over year. You always need to verify your specific benefits before assuming coverage. Our staff can tell you which plans we're contracted with, but we cannot recommend a specific insurance carrier or plan for you. There are some resources for unbiased information, one-on-one help choosing or reviewing a Medicare plan. So they have like the Florida's Shine program, which is a free program that you can use as a neutral resource. And I'm going to go over on the next couple slides exactly what insurances we cover and where we cover them at. And this is referring to primary insurance coverage, not supplemental coverage. So we're talking about primary insurance coverage only. So for Majestic Oaks and outpatient therapy, they share what's called an NPI number, a National Provider Identification Number. So their insurances are linked for the most part. So we accept Cigna, both commercial, HMO, PPO plans, Devoted, which is a very localized plan here in Volusia County, offering Medicare Advantage, HMO, and PPO. Florida healthcare plans for Medicare, HMO, but I will tell you that Florida healthcare does not approve outpatient therapy. They do approve Majestic Oaks, but they will not cover outpatient therapy. Freedom and Optimum Health, so they offer both Medicare Advantage, dual eligible plans. Health Spring, which again is another localized Medicare Advantage plan. Humana and their Medicare HMO, PPO plans. And then TRICARE and military benefits. Again, this is primary insurance only. On the home health side, we accept Blue Cross Blue Shield and WellCare products on the Medicare side. Carelon, which is an Aetna product, so Aetna Medicare, HMO, PPOs. CareWorks, which is a workman's comp policy provider. Cigna commercial plans. Again, we also accept that Freedom and Optimum Health. HomeLink is another workman's comp provider, and they have some commercial Aetna products. Again, we accept Humana in home health. However, Humana's Medicare Advantage plan decided they wanted to use all of their own providers. And so although I'm contracted with Humana, when I call to get an authorization, they will not give me one. So I likely will not get approved for a Humana coverage for you in home health. We offer integrated home care services, which is an intermediary for AvMed, CarePlus, CareSource, Curative, Devoted, and Simply plans. Again, we accept TRICARE and then WellCare Medicare Advantage. United Healthcare. I know a lot of you have United AARP as a primary. We are currently out of network with United across all service lines on campus. United has become increasingly more restrictive with network participation in most markets, including ours, and they remain closed to new providers. They just opened up the skilled nursing side, so we are actively working to try to get approval on the skilled nursing side. I am also trying to get Martha approved, and we're going to simultaneously apply for home health, although I don't know that we will see home health go through right now with the way the market is. If you have a United plan, you should verify your out-of-network benefits directly with United before assuming coverage. Now, Mike Buxton talked to you about your home advantage being in a CCRC. So if you live here and you need Majestic Oaks and United is not accepted, we are going to try to work with United, and we're going to use the home base rule to try to get them to approve your coverage. I have very little control over whether or not they approve that. They might approve it, and you may still have higher copays. We will do our best to try to minimize or reduce that. When people come to me and talk to me about insurance and what to do as open enrollment is approaching, here is my kind of standard answer for everybody. If you have an insurance product that you are happy with, it covers most of your services, your prescription drug plans are good and you're happy with those. When you go see your provider, you don't have any issues. You've had other procedures possibly done in the hospital and they were covered by your insurance, and you are relatively healthy and happy, keep your insurance. We will figure it out on the back end somehow. We will do our best to work with you and your insurance should you need services in one of those other areas. However, if you are experiencing increased visits to the hospital, you are noticing your health decline, you are needing more and more services, it may behoove you to consider another insurance product as we go into open enrollment that would be covered at one of our locations. So we do work with a managed care provider company who tries to contract with managed care services, both on the home health side and on the skilled nursing side, and we work constantly to try to improve the offerings that we have available to you. But I will also tell you that even though we accept insurances such as the Humana, we run into issues with authorizations. We accept Blue Cross Blue Shield, but some Blue Cross Blue Shield plans get turned down. So they're all very specific. So that's my spiel about United. So we continue to try to work with United. I know I have a large resident population on United, and we are working on it. Yeah. Supplementals are I'm not talking about supplementals. Usually supplementals will cover no matter what. So supplementals usually will cover. This is primary insurance only. All right, so I also want you to be aware that you need to be your own advocate. You are a John Knox Village resident, and when you go to the hospital, you need to make sure that they know that, because you have services available here. When you're in the hospital or an outpatient setting, you're seeing a surgeon, you're talking to them, please tell them where you live and where you would prefer to receive your medical care. We've received reports recently of residents being told in the hospital, we don't want you. We were told we didn't have a bed for your insurance, but those patients were never ever referred to us. They were just told at the hospital setting that we didn't want you back. That is absolutely not true. We absolutely want you back. You have the right to ask specifically to be referred back to John Knox for rehab, skilled nursing, or home health services. So please speak up for yourself. Ask the care team directly to please refer you back to John Knox. Even if we are out of network, such as the United situation, we can still help connect you with trusted allies in the community that we've worked with. Don't let insurance be a reason that you're steered away from John Knox. Okay, please speak up for yourself and advocate for yourself about coming back home for care and services. So in the very beginning, we talked about that comprehensive health team with you in the middle and all of the various services, but it's not just those that we offer. We offer pharmacy support. We have a registered dietitian. We offer medical transportation and security, dining services, housekeeping, laundry, maintenance, all designed to better support you as you walk through this stage of your life. The other thing I often get asked is, who should I call? Who should I call when this happens, or who should I call when that happens? My answer is always the same. Start with the medical response team. Call Stephanie first. She is a great hub for everything. If you're having any concerns with your health, if you're noticing a change of function, if you have general health questions, call Stephanie. If you are contemplating or are scheduling a surgical procedure or a medical procedure, even if they tell you you will not need support afterwards, no, you'll just be able to go home, it'll be fine, you won't need any care and services, please let us know, because sometimes that doesn't work out that way, okay? And we're out there at 9 o'clock at night because you're bleeding through a dressing or something. Please let us know so that we can plan to be supportive of you if you're having any type of procedure. If it becomes harder for you to do things that you once did, please call Stephanie. Let her help you through resources that might be available. Any other changes or concerns that you have about you or a loved one or a neighbor, you can call Stephanie. We will not throw you under the bus with your neighbor, I promise. We will just say that we heard anonymously. It's fine. We'll say we observed something. We blame it on the chaplain all the time, so it's fine. It's fine. Your first stop should always be our medical response team, so please call Stephanie. Her extension is 1407. I do have a slide on here that gives you who you can call for direct contacts. These will all be available on YouTube, so you have them, but it includes Stephanie, the nurse practitioner clinic, home health, outpatient, Oakview, Oak Haven, and Majestic Oaks. So I talked about a lot of like did you knows and facts as we went through. So really what we're looking at is knowledge is prevention, and partnership should be the plan. We are not trying to work against you on the clinical side. Trust me, we want to work together. And what you know today can help keep you more independent for tomorrow. If you still don't know who to call me. I am always available to you. I am on call for the campus 24/7. So everybody, well, John Knox staff know how to reach me at any time if there's emergency. So please, if you have questions or concerns, please don't hesitate to reach out. I'm here for you. Any questions? Really? Shocked. Questions? She's going to come around with a microphone. Give her just 1 second. She's coming with a microphone.
Is your information only on YouTube, or is it on that the other website?
It's also on Cubigo.
Cubigo, okay.
Mm-hmm. We purposely spread out the questions so that Candace has to walk back and forth.
Your steps in. That's right. I have a question about weekend coverage. We had an incident where someone fell and called security, and they had to wait for the nurse to come from Majestic Oaks. I thought that there were EMTs or somebody on duty, at least in the daytime on weekends. So what is the coverage on weekends?
So yes, the coverage is Monday through Friday, 7 to 3 with Stephanie, and then 3 to 11. I have Sam in the evenings. We have had a couple little glitches recently because my home health nurse, who's normally here on Saturdays and Sundays, broke her leg and wasn't available, so we did have a little bit of piecemeal coverage for that. But Majestic Oaks and Oakview Suites are always the backups that are available. I do, yes. They're back. now. And I just hired another one, so. But sometimes I have a staff member that gets sick or calls out, so we have to adjust a little bit. But
It gets to the question about the breadth and the length of all the services that you talked about. It's impressive. I guess the key question is, do we have enough people to really, in a timely way, respond to needs? Because you hear all the time about, I can't get a return phone call, all I get is an answering machine. And are we staffed up to really cover the kinds of things that you're talking about?
I mean, in my opinion, absolutely. So we have, over the last few months, made sure that we have RN coverage across the board. So I have RN leadership in Majestic Oaks, Oakview Suites, Oak Haven, memory care, in home health. Like I said, I am available 24/7. So if anybody cannot get a hold of, I'll tell you the cheat method. If you dial through the voicemail system and you get that after hours voicemail, to press 1 for this department, press 2 for this department, whatever. If you press 5 for home health, then you get an option. Do you wish to speak to someone immediately, or do you want to leave a voicemail? If you opt to hit immediately, it rings through to my cell phone 24 hours a day, 365 days a year. So if you ever have any issue with it, you can't get a hold of somebody, then call me.
Hi, Nicole. Joey Lynn and I have been privileged to be on the Healthcare Committee and Wellness Committee. And we have worked with Nicole for several years. I can only tell you, she is wonderful, and what we have learned today, even though I've been on the committee for a while, I've learned a whole lot. And I hope all of you have earned a whole lot. And we are very, very fortunate to have someone like Nicole and her staff here. I think he deserves a round of applause.
Thank you. I will say that it is approaching flu shot season too, so our flu shots have arrived. So we will begin planning our flu shot and pneumonia shot clinics. So if you want to get vaccinated here on campus, we'll start getting that information out here shortly. We usually start vaccinating in October. There's no
One more quick question. When is the time when we should call a 911 as opposed to calling your medical response team?
So that's a great question, and we talk about this sometimes in the healthcare committees too. Anytime you are experiencing a true medical emergency, you believe you are having a heart attack, you believe you are having a stroke, you cannot breathe, you have fallen and have a serious injury, please call 911 first. We do not ever want you to have a delay in receiving medical services. Our pull cord system, dependence, that is a courtesy call system. It is not designed to replace any emergency services. You are certainly welcome to call them and then call us or call the gatehouse and let us know you've called 911. We will try to get there and assist. But please, if you are having a true medical emergency, call 911.
Hi.
Hi.
I was having OT the other day, and the caregiver was wearing a mask. And I said, "Oh, are you sick?" And she said, "No, there's COVID going around." Is that true?
That is true.
How many do we have on campus?
So I think right now I have a total of 21 cases. It is almost exclusively at Majestic Oaks. What happened is on Friday we had a staff member present with respiratory symptoms. We tested that person and they were positive for COVID. I was not anticipating a COVID outbreak in August. It was nowhere on my bingo card. But we had a couple other staff that were out that day, so we tested those people as well. They all then tested positive for COVID, so we do currently have an outbreak, mostly at Majestic Oaks. We are following all of the same protocols that we have done for the last 5 years. Staff who are positive are isolated from work and have to have 2 negative tests before returning. The unit that was impacted, all of the residents have been tested and all of the staff that work those units have been tested. The health department was notified as soon as we had the outbreak identified. They are actually coming to do an inspection at Majestic Oaks, as they always do, on Thursday. So what I think happened is school's back in session. And, so August is the time when we end up with a lot of increased infections. I was not anticipating COVID yet, though. So it seems to be very mild symptoms, but seems to be pretty rapid spread, since we had so many cases pop up almost instantly. But we have not had new cases come up. So from our initial group of testing. So nobody in independent living that I am aware of as of yet. But I will tell you, if you think it's just allergies, it's not. If you're feeling sick, please call us. We have tests available that we can come out. The medical response teams can come out and test it. I am not aware of any cases in independent living, and no staff that work in independent living.
Well done.
I cannot believe I finished on time.